Good evening, and thank you for joining me today to learn more about premature birth and what you can do to help. Did you know next year alone, an estimated 15 million babies will be born prematurely? This December, 33,000 babies will be born as preemies. That's roughly 1,000 premature babies per day. But what is a premature birth? According to the Mayo Clinic, a premature birth is a birth that takes place more than 3 weeks before the baby's expected due date. However, there are 3 different levels of preterm births. Those spending less than 28 weeks in the womb are considered to be extremely preterm. Those that are born at the 28 to 32 week mark are considered very preterm, and the most common level, moderate to late preterm births, occur at the 32 to 37 week period. As you can see in the visual platform, every week is detrimental to the development of the fetus. Are you at risk? Mothers are considered at risk for having a premature birth if they smoke, drink, or use recreational drugs while pregnant. It is also common for mothers with multiple pregnancies, like those having twins or triplets, to experience birth prior to their actual due date. Another risk factor is age. Females under 18 and women over 45 are more at risk than, let's say, a 25-year-old. The appearance of preemies can be much different than the appearance of a full-term baby. For example, a healthy full-term baby is expected to weigh around 6.5 to 9 pounds, whereas a premature baby typically weighs under 5 pounds. The baby's head may appear much larger than its small body. Their skin may appear as a bright pink and sometimes translucent, and the soles of their feet might also appear very wrinkly. The most common short-term effects are apnea, PDA, jaundice, and bronchopulmonary dysplasia. Feeding problems may also persist as the baby's swallowing reflex isn't even developed until week 33. Common long-term effects include asthma, vision problems or vision loss, hearing problems or hearing loss, and the more serious cerebral palsy, which is a muscle disorder affecting muscle coordination, movement, and balance. Blood vessels in the back of the eye may also become swollen. ADHD and ADD behavioral issues are also very common. The March of Dimes was originally created by Franklin D. Roosevelt in 1938. Basil O'Connor, a close friend of FDR, stated that the March of Dimes was established with the mission to raise money and deliver aid in reference to the polio epidemic. Following the development of the polio vaccine, the mission of the March of Dimes changed and widened to raise awareness and funds to the crisis of prematurity. Since the switch in 1990, the March of Dimes has been successful in working towards their goal of a fighting chance for every baby. Last year, in 2019 alone, the March of Dimes raised $48 million for prematurity. Another great organization, known as the GRAMS organization, fights for premature babies as well, by providing care packages for families, support groups for other families experiencing the same thing, and around-the-clock train assistance for anything you may need regarding your preemie. Although you can't completely prevent experiencing this type of thing, you can do several things to help lower your risk of premature birth. When pregnant, you should continue to be physically active. You should also consult your doctor as soon as you know or suspect that you may be pregnant. It is also important that while you're expecting that you don't smoke, consume alcohol, or use recreational drugs, as it can be a leading cause to premature birth. It is also important that you become educated on the signs and symptoms of premature birth before having labor. Although the premature birth rate has declined due to a decrease in teen pregnancies, premature births are still occurring too frequently. As mentioned, 1 in every 10 babies born will be born prematurely. If you would like to learn more or donate to the March of Dimes, or learn more about their mission, visit www.marchofdimes.org. Thank you so much for listening in on premature births.